Greg Smith.
Thank you, Madam Deputy Speaker, and I rise to add my voice in this debate to the urgent need for the government to develop a Plan B. A Plan B if the vaccine that we all hope and pray can be developed and comes good, in fact, does not materialise. For I'm clear in my mind that if that vaccine is not forthcoming and forthcoming quickly, we simply cannot, as a country, go on much longer with the restrictions that we have. Now, COVID is, of course, a horrendous disease, and it's right that all reasonable steps are taken to quell its spread. But we must also look, as others have said, at the deprivation of liberty to all our daily lives. The impacts, despite the unprecedented and enormous support package the Chancellor has put in place on jobs and livelihoods, particularly for those who have so far been unable to access support. Health outcomes for those suffering with conditions other than COVID and long-term mental health challenges. And as I've reflected on this debate, I've read and reread many of the emails I've received from my constituents about the impact of these restrictions, real life stories. For example, in the examples I give, I will maintain the privacy of my constituents by not naming them. But Mr W writes, I felt the argument being made to flatten the curve and protect the NHS and save lives made sense, and with a matter of perhaps 3 months or so, could return to normal and recover. That did not happen, and the lockdown cost me my business, it cost me my relationship, and worst of all, it cost me my health. And to be clear, Mr W did not lose his health to coronavirus, but a misdiagnosis of a DVT. On the next case, and I pay tribute to my honourable friend, the member for Rutland and Melton, on her work around maternity services during this pandemic, a cause highlighted by the following case of my constituent, Mrs S, whose husband has been denied access to join her at appointments, not least at the review meeting following an emergency scan following concern of a heart complication in their unborn child. Mrs S writes, I can honestly say, waiting for that review meeting with the consultant was the most agonising wait of my life. So much so, I entered the room in tears, unable to control my emotions, when all I needed was the support of my husband. And what made it all the more complicated for Mrs S was that she couldn't understand why in the room, where there was a sonographer, the consultant and a midwife and herself, that her husband couldn't be there, given that her husband works fully from home, does not even leave the house for a weekly shop. She concludes, I'm sure there are multiple women who've had to go through this devastating news alone. I turn to Mrs K, whose son was so excited to go to Exeter University this year, but on arrival has been treated worse than a prisoner in his hall of residence, with sniffer dogs deployed on site to break up groups of students. The isolation of this experience has taken a serious toll on him, leading to him to have to return home. And that is before I get onto the list of the many businesses who, if they've not already gone bust, face the prospect of doing so. And so, I seriously hope and pray this vaccine comes good, and that we can get our lives back to normal. But if the vaccine doesn't come good, I urge my honourable friend the Minister to consider that serious Plan B of how we do learn to live with this virus, and look at the work such as Dr. Raghib Ali, and listen to other ways that we could move forward.